Welcome to Jeevan Jyoti Institute of Medical Sciences, serving you medical comfort. Vaisach Vritya Sukhad.
Hello and welcome. I'm Jyoti Singh from Intellico Research and Services, and today with us we have Dr. Ratnadip Bose. He has done his MBBS from M.CH and he has done his MS in General Surgery from JJIMS. He then went on to do his M.CH in Neuro-Surgery from AIIMS New Delhi and has been practicing as a consultant neurosurgeon at Medanta, the Megacity, Gurgaon. He has been visiting the Jeevan Jyoti Institute of Medical Sciences, Silchar, for a few months now and has proved to be an important asset to the institution. Sir, how does it feel to be here first of all?
It's fantastic. So far it has been a fabulous journey and I feel myself very privileged to come here and serve the patients from the place where I have grown up. And frankly speaking, all the years I have been literally pondering how to give something back to my place of birth, and there is actually dearth of proper relative care in this place. And once I've started coming back here, I really look forward to spending more and more time in this place, so that at the end of the day more and more people here also get the benefit of modern day science.
So talking about neuro-related care, would you like to tell us something about the impact of head and spine injury and how it is to be treated, and what is the approach that a layman should take when they face a head or spine injury?
See, statistically speaking, after cancer and heart attacks, the third commonest cause of death in the world is because of head and spine injury. And unfortunately, this affects the breadwinners of the family in most of the cases. Hardly we come across head injury in a small kid or in some very old age person. Mostly it affects those people who are the breadwinners of the family. I can say that. So it has a huge impact on health as well as the economics. So first and foremost, we should be aware, people en masse should be aware of the long-term impacts of head injury, and the stress should always be on prevention. I have not come across maybe more than 10 persons at any single point of time who are using helmets while riding two-wheelers. So people should be more aware, the traffic cops should be more vigilant. So it's very important because wearing helmets prevents a lot, many cases of head injury. It actually saves lives. Similarly, spine injury is also another catastrophic event which usually makes somebody paralyzed lifelong. So, driving safely and good roads is a very essential factors in prevention of head injury and spine injury. And another very important factor to minimize the long-term suffering is very early treatment. So in case of brain and spine, every single minute counts. At times I have seen here, I have heard about sad stories about people who have had head injuries or spine injuries. Having no other option here, they have to take the patient all the way to some other place or just left here to rot. So shifting a patient from to a different city altogether, it actually kills time. So I believe that this place needs a good neurosurgical center. The way this hospital is building up, and they have a vision. So in near future, we hope that more and more people from this place will have reasonably good care.
Right, sir. So the people here need that kind of care which is available in the bigger cities in the country. And regarding that, one of the most common ailments we see today is disc prolapse. So is that an ailment that happens only to the older people, and does it really affect the younger generation or the middle-aged people?
See, the popular and common myth was that the degenerative disc diseases usually impact people when they're beyond their 50s or 60s maybe. But basically this is a disease of the civilization. today's world, as our lifestyle has changed, our daily habits have changed. So more and more we're coming across people pretty early in their 20s and 30s who end up having slip discs. Maybe wrong posture, a wrong gym trainer, and too much of ambition in that making those six packs. People usually end up having this prolapse pretty early. And it's bad because in early stages it of course causes just pain in the back and some tingling, some numbness in the hands or legs. But once it gets severe, then it can end up causing paralysis, loss of control of urine and stool. So it is a very nasty thing to happen. And since more and more younger people are getting affected, so we should be aware about safety of our spine.
So today we are increasingly starting to hear about brain tumors. Brain tumors are seen as something that is very dangerous and is regarded as something that could be fatal. So are brain tumors always lethal?
See, it's a very interesting journey of medical science so far, and things are changing so rapidly these days. From bullock cart to aeroplanes, we took several centuries. But the point where the diagnosis of brain tumor was a death sentence, to a stage where a person comes back home after a surgery 3 to 4 days hardly, and then resumes his work within a week or 10 days. So this transition has happened over hardly a few decades. So sadly, all the access to such newer technologies are still yet to percolate to the backward cases all over the world. But then, of course, today's science has given us this option, this possibility that in majority of the brain tumor cases, the patient usually comes back home hale and hearty. But it is not something to be very scared about. Of course, having said that, there are certain bad brain tumors, cancerous tumors, which usually are lethal. But a sizable number of other tumors are also there, which can be treated permanently without causing any damage to the patient.
So another issue that we would like to touch on is a stroke. So what is it that causes the stroke? How do we prevent it? And what are the early signs that one should look for?
See, stroke usually has been happening to mankind since we have been cavemen. There are basically two types of stroke. One where there is sudden lack of oxygen supply to the brain because of some blockade in some arteries of the brain. And there's another kind of stroke. The first one is called the ischemic stroke, which happens in around 70 to 80% cases. In 20 to 30% cases, stroke happens like this, that there is suddenly an artery bursts open and there is a large clot or a hematoma inside the brain. This is called a hemorrhagic stroke. It happens in around 20% cases. Both the kinds of stroke, they require immediate hospitalization. In a sizable number of cases, patient ends up having paralysis on one side of his body. But timely treatment with certain medicines and if need be, surgeries at times, it usually helps to salvage the patient. And the stress should always be that nobody should have a stroke. So the prevention is another very important pillar of stroke management. Once a person has had a stroke, we should do all out effort should be given so that he doesn't have a second attack in his lifetime. So control of blood pressure, control of blood sugar, and then quitting smoking and alcohol drinking, these are paramount.
Thank you, sir, for your insightful words. We are glad to have you here today.
Thank you.
Thank you so much.